You have a headache right now, or you will tomorrow. And without thinking, you reach for a pill. Your ancestors had no pill, no pharmacy, no doctor with a degree, just pain and a world that might or might not help them. So how did ancient humans survive without modern medicine? The answer is that they built medicine of their own. You just never learned its name. Start with willow bark. Long before aspirin existed in a bottle, people across ancient Egypt, Greece, and China chewed on the bark of willow trees to ease pain and fever. They had no idea why it worked, but it worked. Centuries later, scientists isolated the active compound inside it. Salicin. The same molecule your aspirin is built from today. Your ancestors found the chemistry first. The lab just caught up. Move to wounds. Ancient Egyptian medical texts, like the Edwin Smith Papyrus, describe using honey to dress open injuries. Honey is naturally acidic, low in moisture, and creates an environment hostile to bacteria. Modern hospitals now use medical-grade honey for exactly the same reason. What looked like folk ritual was functional antimicrobial treatment, 4,000 years before anyone understood what bacteria even were. They were not guessing blindly. They were watching outcomes generation after generation and keeping what worked. Now think about infection itself. Trepanation, the act of drilling a hole into the skull, sounds horrifying to you. But archaeologists have found ancient skulls with healed bone around the drilled opening. Healed. That means the patient survived the surgery and lived long enough afterward for new bone to grow back. Some of these patients endured this more than once. Whatever crude logic guided that decision, someone, somewhere, was getting it right enough to keep people alive. Childbirth carried enormous risk with no modern intervention. Midwives passed techniques down by word of mouth alone. How to turn a breech baby, when to intervene, which herbs slowed bleeding. This knowledge lived entirely in memory. Mother to daughter, healer to apprentice, refined slowly over thousands of years of trial, loss, and careful observation. Quarantine is not a modern invention either. Long before the word existed, communities facing plague or fever instinctively separated the sick from the healthy. They did not understand germs, but they understood pattern. Sickness spread through closeness, so they created distance. That single observed pattern saved more lives across history than almost any single medicine ever could. This is the part that should genuinely surprise you. Ancient survival did not depend on understanding why something worked. It depended on noticing that it did and trusting that pattern enough to repeat it. You live in a world of explanations. Your ancestors lived in a world of evidence. They watched, they tested, they remembered. And slowly, without microscopes, without germ theory, without a single diagram of a human cell, they built a working system that kept enough of them alive to become you. Modern medicine did not replace what they did. It explained it. The next time you take a pill, remember this. Somewhere behind that little tablet is a person standing in a field thousands of years ago, chewing on bark, watching what happened, and deciding it was worth trying again. You are not the end of that story. You are just the part of it that finally understands why it worked.